Well, good Tuesday morning at 7 a.m. Hope you're having a great start to your day. We have a beautiful view for you this morning if you got out early of a moon, a harvest moon mixed with a full moon mixed with a lunar eclipse. This is something that doesn't happen very often, but depending on the time that you saw it today, you may have seen all triple threat of a beautiful display in the sky. That's what took place this morning. I pulled out of my subdivision. I was like, holy cow, how close is the moon today? So I hope you had a chance to see that. If not, transitioning into a beautiful sunrise that a lot of my team was oohing and eyeing over. That's why you want to wake up early, because you would miss these beautiful things if you slept in. I hope you're having a great start to your day. I'm your host, Monica Adams. The show is called The Real Monica Adams Show, and today is really going to play out in that respect as we talk about real health topics for you men. Today is all about the guys. Now, women, I need you to listen, because you'll be the ones that will get them talking, hopefully talking to their friends, to maybe their sons, their brothers, their dads, their grandparents, all of these things that need to be talked about that you will possibly at some point in your life experience. Maybe you are already. We're going to talk with Dr. Salim Hawatmeh this morning with South County Urology about many things, including erectile dysfunction, incontinence, prostate cancer, screenings, as well as doing those tests. Women have a tendency to talk about these things with each other, our health issues, much more than men do. And today I'm hoping to break through the taboo, the stigma that is out there, and get you talking. That is my goal for today. So start sharing and telling people to listen in and interact with our doctor that's coming up in about 10 minutes. Let's start off, though, with your forecast. We don't have Beckett today. He'll be back with us on Friday and tell us all about the convention that he's at. We're giving you a 10-day forecast today because we are looking for the possibility of rain, and it comes a lot later in the forecast. As you see, lower humidity today. It's actually nice, but look at these temperatures. Summer is definitely hanging on. 89 for the high today, 90 for Wednesday, 91 on Thursday, just keeps going up. A very slight chance of rain on Friday with a high of 92. Now you understand why you wish you still had pools for the kids to go to. 88 on Saturday. Sunday, we do have a slight chance of rain, 30% chance, 87 for the high, and that is the start of fall. Monday, slight chance of rain with a high of 84, and then we continue the 10-day forecast, 83 on Tuesday, 81 on Wednesday, and 82 on Thursday. Thanks to our friends at First Alert 4 for their 10-day forecast. Now, we're going to get into the news, and we're going to continue to do follow-up stories for anything that I feel you need more information on. We, of course, talked about the second assassination attempt on former President Donald Trump. What you may not know is now they're talking about ties to St. Louis. There's an investigation that First Alert 4 did that uncovered that the man suspected in the apparent assassination attempt of former President Trump has ties to St. Louis County. The 58-year-old you're seeing here on your screen, Ryan Wesley Routh, was arrested Sunday, charged Monday after authorities say he stalked the GOP presidential nominee as he golfed in West Palm Beach, Florida, with a rifle in an apparent assassination attempt thwarted by the Secret Service. Now, Routh, the suspect, previously appeared to encourage the killing of the former president. That's the latest that's emerged, and it was in a book titled Ukraine's Unwinnable War. This is the tie to St. Louis. The editor involved in that book is Kathleen Schaefer, and she has ties to St. Louis County. Former, again, I should say, several aspects with regards to owning property in the area. She reportedly lives with Routh in Hawaii and helped him pen this book where he talks about assassination. He talks about calling the former president a fool and a buffoon and saying, I was wrong to support him in the past. You now have my okay for assassination. Again, a lot of legs to this story, but this is the latest with ties to St. Louis. Breaking news overnight, Sean Combs, you know him as Sean Diddy or P. Diddy, he was arrested in Manhattan after a grand jury indictment. The music mogul's been under mounting scrutiny since a 2023 lawsuit by his former girlfriend Cassie, accusing him of sex trafficking and years of abuse. According to the latest authorities, they say he was arrested in Manhattan Monday after a grand jury indictment. The U.S. attorney said in a statement, "We expect to move to unseal the indictment in the morning, and we will have more to say at that time." The arrest comes after nearly a year of accusations and lawsuits filed against Combs by several female artists and producers accusing him of sexual misconduct. Well, listen up if you've bought ground beef recently and you live or you shop in the Belleville, Illinois area. This is very specific in the time frame that it was sold. This is on Carlisle Avenue, the Schnucks in Belleville, sold on Sunday between 12:45 and 5:45, and the sell-by date, September 16th. I heard it could have plastic in it. If you went to that Schnucks during that time frame, take that beef and return it to the store for a full refund. There's a meeting that's going to take place today with St. Louis County Council. A lot of you who maybe went to the Battlehawks games or anything ever since the Rams left have probably looked at the aging dome in the convention center and thought, what are they going to do with this? Well, they're going to have a meeting today to talk about this, but it's pretty pricey. In fact, $150 million just for the aging dome. That's not even including what's going on with the convention center. So interesting to see what will come out of the council meeting later this afternoon. If we get more information on that, I'll pass it along to you in tomorrow's show. Another follow-up story has to do with the dog park in St. Charles County. We told you recently that they were draining the pond at Brommelsick Park because of that blue algae that could be toxic to your animals. Well, they are getting rid of it completely, that feature. The pond at the St. Charles Dog Park removed following months-long closure, and they have a plan for the new dog park in the works. This would be a piece of land with the park within that area at New Melly Lakes, and it would still offer an opportunity for the dogs to do what they love, swim. It would offer a 10-acre lake for the dogs, but the old pond that you were used to, that maybe you went to before, is completely gone, and they're thinking that this New Melly Lake area will be much less ability to have that toxicity for your animals, so that's good news. Also, I mentioned last week, Evolution Fest coming to St. Louis. Well, there's one band that will not be appearing there. Jane's Addiction has canceled their entire tour, and that includes a performance at Evolution Festival. It's all because of this. The alternative rock band had a scuttle in their latest tour following an on-stage scuffle between the lead singer and the guitarist. The band have made the difficult decision to take some time away as a group. As such, they will be canceling the remainder of the tour. That's according to the band in a brief statement. The move comes a few days after videos captured the two at a concert in Boston, and again, bumping shoulders and then taking a swing at the guitarist. Navarro was seen holding his right arm out to keep the singer away and then dragged away by others on stage. The show ended. The band apologized, but again, they will not be a part of Evolution Festival. A couple things happening this week at Forest Park. Thursday night, the St. Louis Symphony will have their free concert, which is such a cool thing if you've never been to it. It'll be at 7 o'clock Thursday night. And again, it'll take place on Art Hill in Forest Park. They'll have areas where you could buy food. They'll have probably, I would think, food trucks, things like that. Stéphane Deneuve is the conductor, and Kennedy Holmes will be on vocals. Do you know Kennedy? I had a chance to interview her. She used to be on The Voice. She's from our area, so she'll be performing. Again, that's Thursday, 7 p.m., St. Louis Symphony Orchestra, free at Forest Park. And speaking of Forest Park, that's where Friday and Saturday, thousands upon thousands will be for a free family event. The Great Forest Park Balloon Glow is Friday, and the race is on Saturday. I don't know if you have not been to that, but you're missing out if you haven't, because it's such a good time. And yeah, great pictures that will be lighting up the gram, right? So Instagram and TikTok and Facebook, it's all for that and for your family fun. Well, St. Louis Cardinals back in action tonight against the Pirates. Game time is at 6:45. They're actually coming off of a win. They're in their final games, unfortunately, of this season at Busch Stadium. And there we go, right on cue, 7:10. You're all wrapped up in weather, in news you can use, and in sports. And then we're going to take a break. When we come back, Again, I can't stress enough, this is going to be a very powerful show today. We had an incredible show with Dr. Sarah Jensen within the last few weeks talking about menopause, perimenopause, postmenopause. I have been stopped more on that show than any show we've done in the last year because women said, thank you for getting us to talk. Well, it is my goal today for that to happen with men. Men no longer think that these subjects are taboo. You've got to talk about them. If it's happening to you, it's probably happening to a friend of yours, your uncle, your brothers, your grandpa, maybe your sons. Get them talking. All right? Dr. Salim Hawatmeh from South County Urology will be in the blue chair when we return.
I'm excited to announce my all-new mattress topper. In the times we're in, I wanted to bring you the best affordable mattress topper ever. So I took my two best technologies and combined them to make the ultimate mattress topper. And now you can get it for as low as $69.98. Queen size, only $99.98. It all starts with my famous MyPillow foam that provides you that overall full body support. Second is the individual comfort supports that give you an amazing custom sleep experience. It's like it's made specifically for you. The queen size alone has over 14,000 comfort supports. This is the perfect mattress topper to improve any bed. New bed, old bed, your guest beds. Get them for every bedroom in your house. Go to mypillow.com or call the number on your screen. Use your promo code to get the all-new My Mattress Topper for as low as $69.98. Queen size, only $99.98. Don't delay, order today.
Discover your full potential with a personalized styling experience. Designing, customizing, and transforming the looks of men and women. Revamp your individual style and embrace what makes you, you. That's real confidence.
So you may think these topics are taboo. I want to erase that from your mind today. Erectile dysfunction, it can affect your self-esteem. Think about this for anybody that's gone through it. It may impact your most important relationships. If you've tried pills, pumps, maybe even injections, and have yet to find a satisfying solution, there is hope, and that's what we're going to give you today. You know, this show's all about hope and possibility. You can take a free online assessment that you can share with your doctor. If you want to know more about this, I want you to go to this link. It's edcure.org because there is a permanent, satisfying solution to treat erectile dysfunction. Again, edcure.org. Go to that website. It's brought to you, by the way, by Boston Scientific. At 7:13, welcome back to the Real Monica Adams Show. So yes, these are real health topics for men and for women to be listening to get your guys in to talk about this. I hope, again, I'm not telling you that you're going to go out and have beers with the guys and you're like, hey, dude, let's talk about this. But maybe you do. Maybe you say, I saw this show, and maybe it breaks off after you've been together and you start talking about it because we've got to get men talking. I know my guest is going to agree with this. Dr. Salim Hawatmeh, a longtime friend of mine I've known for many, many years, South County Urology. First of all, welcome into the show.
Thank you very much. I was thinking about this. You did one of my first interviews
when I was on
career.
KMOX?
That's correct, yeah.
Oh, really?
So it's good to be back.
It's been too long. Let's not have that big gap in between again.
That's right.
Well, I want to welcome in. Again, we're talking about topics that I wish men would stop thinking are taboo. I mentioned that we have women talking so much now about all the things that they go through with perimenopause, menopause, postmenopause, believing they have to live their life that way. You, with all your patients, probably hear the same thing of guys thinking, oh, I thought it was just something. I've had a lot of guys knowing that you were coming on saying, okay, ask the doc, isn't it something we should just get used to, though, as we get older? Isn't it going to happen to us? So that's the very first question for you.
Right. Well, yes, a significant number of men do suffer from ED at some point, especially after 40s, 50s. But as you said, there are treatment options, and you don't have to live that way.
Right, because they think that their relationships are going to break down. One of the greatest things I think that I've heard from men is, I don't even want to talk about erectile dysfunction. I don't want to think that's something that I'm dealing with. They start to have symptoms, which I want to talk to you about what that looks like. And then they feel bad about themselves because they think it's going to be affecting this amazing relationship that they have.
Correct.
So what are the symptoms for this?
Yeah. Well, for ED, obviously the inability to achieve an erection or maintain it as long as you would like. So, and that other men have issues with premature ejaculation, for example, and there are treatments for that as well. But I see a lot of guys also that suffer from, low T, and they have low sex drive, low energy. They're not sleeping as well, not performing as well at work, not getting the gains they would like at the gym. And there are treatments for that as well.
Well, let's talk about that, though, because there are a lot of clinics out there, and this is what I'm fearful of. I don't want you to hear, oh, well, let me go get some labs done. My testosterone's low. I'm going to go to one of these clinics, and they just jack up their testosterone so much that it's over the top. So if, in fact, they have the symptoms you just mentioned, should they be coming into you, having labs done, and then talking to you about the testosterone aspects?
Yeah, absolutely. And many patients come in, they have screening labs from their primary doctors, and they bring the results to us. But yes, some of these clinics, some of them are friends of mine. I know them. They do a fine job. But, urologists were the sort of the stewards of men's health. Yeah. And there's a lot of, especially in social media, a lot of snake oil out there.
Right.
And so forth, things that are being promised. So, yeah, seeing a board-certified urologist, specialist in men's health, obviously, I think that's the first step, the most ideal thing to do.
I challenge any of you guys that are watching this morning to drop comments in and be willing to say, yep, Doc, I am going through these. I would love guys to be asking questions. If your guys won't, then women at home with them, maybe you can ask the questions for them. But it's to get you talking. That's the biggest thing that I'm hoping happens today, and it's a carryover that continues from this. So we're starting with erectile dysfunction. We're going to talk about incontinence, and I thought this was so powerful, Salim.
Right.
Somebody that I talked to over the weekend said, men have incontinence? 1 in 10 men have urinary incontinence?
Well, unfortunately, most commonly we see it as a side effect treatment for prostate cancer. Mm-hmm. And many men that have had their prostates removed or other therapies do suffer from urinary incontinence. Yeah. Sometimes despite perfect surgery and robotic surgery, which is highly magnified and with all the new techniques, it does happen on occasion. And men don't have to live that way. They don't have to soak through multiple pads a day. There are solutions.
I love that you just said that. That just gave me chills, right? That is the message that needs to be across. You do not have to live that way. That's the thing about the quality of life. We want you to have the best quality of life while you're here on earth, and you don't have to give up on yourself. How many men, well, first of all, how long have you been in urology?
So I finished residency training. I was at the Mayo Clinic in Rochester, Minnesota in 2006. So I've been in St. Louis since 2006.
With your father?
A long time. With my dad, correct, yeah.
Such an amazing man. And again, this is South County Urology. We're showing you some pictures of the gentleman that you'll see when you go there. We'll bring up the address as well. There you go, Monday through Friday hours, 8 a.m. to 4:30. They're located, again, on 12345 West Bend Drive, Suite 200, South County Urology, in that medical building right there at 270 and Tesson Ferry. So as you think back over all of these years that you've been in it, what are the greatest burning questions that men are asking you that have to do with the topics that we're talking about today, that give them the aha moment?
Right. I'd say prostate cancer screening is a big one, especially we're in September now. It's Prostate Cancer Awareness Month, and I can't emphasize the importance of screening enough. Normally, all men should be screened with a simple blood test beginning at age 50, unless you have a strong family history like a first-degree relative or are African American. You should start at age 40. And this is a topic of discussion. There were unfortunately, some bad studies published years ago that sort of knocked PSA screening, but it's very, very important to be screened for prostate cancer.
Yeah, and that's the problem. And I always say people get their news on their cell phones or tablets, and they don't know how to decipher between what is right and what is wrong. So do you think that there was a time period that really made that suffer, that men weren't going in and unfortunately weren't catching that early?
Yeah, definitely, because I think that was the message to the primary care physicians. And some were not checking PSA or not as often or not at all. And so as urologists, unfortunately, we saw some advanced disease in our practices. And Obviously, you want to find prostate cancer early because it's something that's highly treatable, something that we can cure patients of or put them in remission for many years.
If you're just tuning in, once again, you just saw Dr. Salim Hawatmeh with South County Urology. So if we look at prostate cancer, because we always look at different cancers, and then as there's advancement in treatment, those numbers go down in deaths to whatever that cancer is. Where is prostate cancer in cancers that men would get?
Yeah, so it's a very common cancer. 1 in 8 men will be eventually diagnosed with prostate cancer, and the rate is doubled for African American or someone with a strong family history, such as first-degree relatives, dad, brother, multiple uncles. And, the deaths from prostate cancer have gone down. Most people with prostate cancer die of something else. But unfortunately, it is the second leading cause of cancer deaths in American men, just behind lung cancer. About 35,000 people in the U.S. will die of prostate cancer this year.
And again, those numbers, 1 in 8, depending on if you have a family history. Again, we talked about African American men. Can we go back to that slide right before that, Zach, if you can? Because I want to show something. There it is. A diet high in saturated fat, as well as obesity, increasing the risk of prostate cancer. I don't know how many times we talk about the importance of eating right, nutrition. Guys need to get this really drilled into their head. So if they start hearing these things that they don't want happening to them, they can take steps to try to do prevention.
That's right. Yeah, age obviously is the biggest risk factor, but there are some genetic abnormalities. They run in families. But also, yes, a heart-healthy diet, maintain your weight, be active. There is some evidence that is protective as well.
Let me ask, as we're talking about as far as how they're eating, guys are notorious for being meat and potatoes guys, right? If they're eating meat day after day after day, is that hard on them with regards to what we're talking about?
Yeah, absolutely. I mean, there are other health issues with eating red meat every day. The most important is cardiac risk factors. And I'm sure you've had guests in cardiology, I'm sure, talking about that. But yeah, I mean, and that also predisposes you to kidney stones, another issue in urology. But in general, I think moderation that's the most important thing. And being active and maintaining your weight, very important.
If we look at and this is what the guys are probably going to ask. If we're looking at a 7-day time period, right, in a week's time, how often should they be eating red meat?
Yeah. I mean, from a urology perspective, the only dietary recommendations I personally make are people that have kidney stones. And I just say don't eat red meat every day. So every 2, 3, something like that. But again, the most important thing is the cardiac standpoint. And I think your cardiology guest would say that that's not a healthy thing to do.
Well, absolutely. And the interesting thing is, we're going to take a break here, but yesterday's guest, who is more into looking at traditional medicine and functional medicine and tying all those things together, we were talking about, I told him I was going to discuss erectile dysfunction with you, and he said, well, it's really interesting from his standpoint about it being a vascular issue, right?
Correct.
And that's what I want to go into. We're going to talk about that. We also have some comments coming in, questions. I encourage you to do that and start sharing this show right now, telling people that we are live, and I want them to ask questions in any way that you can. If you want to get it through someone else because you're whatever, you think it's taboo to be talking about. I'm trying to erase the taboo aspect. With Dr. Salim Hawatmeh, again, South County Urological Group, right there at 270 and Tesson Ferry. We'll have more with your comments and your questions when we return. .425 North New Ballas Road. You walk into that beautiful space and you find my friend Jennifer Warman Bloss, who owns Elemental Aesthetics. So I just went into her last week and had the most incredible facial. So ladies and gentlemen, when you're thinking of going to have a facial, she has the top of the line. She really prides herself on having the most advanced lasers. So maybe you want to have an IPL. You have different types of peels. She's been doing IPL, she said, for over 2 decades. So she truly is one of the best in our area. There's also an opportunity for you to go in and do IV hydration therapy. So many levels of the services that they have. And I can't wait to find out about this bed that they have. So there's a vibration aspect to it, but it's also tied to music. And it's been shown that it's helping people who have ADD, ADHD. Let me think about people who have rosacea, so many other skin problems that we've talked about on the show. Elemental Aesthetics. Remember the name and then take this phone number down. You can do online scheduling if you want. If not, give them a call, 314-279-6069. I know one of our viewers that just went in and said that she had Sarah and said it was unbelievable. So Sarah or Jennifer or whoever they're able to team you up with, she's got an incredible staff. Elemental Aesthetics, thank you so much for being a part of our show. All right, welcome back. The Real Monica Adams Show, talking about men's health issues today. I really want to get you guys talking. Dr. Salim Hawatmeh is my guest, again, with South County Urology, located at 270 and Tesson Ferry. I do want to thank already some of you that have written in, and you're right, Rose. Men don't go to the doctor, she says, until they absolutely have to. At least the men I know. It's like asking for directions. Do you agree with that?
Oh, 100%. Actually, we talk about this all the time. You know, patients will come in as couples, and sometimes you start asking questions to the man, obviously, who's the patient, but the woman is the one who has all the answers, the wife. Without her, you know, a lot of these guys would be in trouble.
Well, and that's why I've always encouraged women to go along with them, because especially some of these things can be very scary that you might be delivering to them. They shut down, and then when they get home, you're asking them, so what did the doctor say? I don't remember, because they are blocking it out. They don't want to hear the words prostate cancer or we have to biopsy, right? All those things. As you know, because we went in and had a scare with Jim last year. Fortunately, his father did have prostate cancer, so he was worried. And in fact, in his mind, he's been waiting for it to happen. I'm like, well, don't will it, right? Don't be thinking about it, but important to get your test done. Absolutely. And so he did. But I made sure, and I will always make sure that I go along with him, so that I'm hearing and coming back and telling him, he said this, but you didn't hear him say this.
Right.
That probably happens a lot.
All the time.
Right?
Yes.
All the time. So whether it's a mom, a wife, a girlfriend, I highly encourage you to go along. So the comment came in from Richard. He said, when I was on 26 medicines, because he's had so many trauma aspects to his body, he said he had problems. Now that he got off the medicine, he said it's not a problem anymore.
Right, correct. Yeah, there's so many side effects of medicines. And unfortunately, ED can be one of them. Again, anything that can affect the vasculature, that's an issue.
And that's what I was mentioning going into the break that our doctor said yesterday. He said a lot of times if you go to a urologist and you're told that you have erectile dysfunction, you should probably be checking also about your heart health.
Right, yes, absolutely. Yeah, because the arteries of the penis are some of the smallest ones in the body, and they can actually be affected first before the arteries of the heart, before others. So yes, that can sometimes be a sign of cardiac issues, correct?
There you go. Sean said cardiovascular health is commonly overlooked in men. Thanks for addressing this topic. He said, I invite men to bring their wives to their first 2 appointments because women usually have more questions about the conditions. Absolutely. And so he's a doctor with Mid-America Spine, and that's the thing. It's trying to get this shift to happen,
right,
which I've been wanting for like you said, I interviewed you forever ago, but in my 30 years, I've been hoping that this change would happen. Maybe today it does. We mentioned that you don't have to live your life with that. So there are treatments.
Right.
We're going to show some video. And as we're talking about this video, we'll continue to say that this is an idea that you can speak about with Dr. Hawatmeh or your urologist to say, all right, I'm dealing with these symptoms. Right. I thought I just had to live with it. Right. But it's not the case. So as we look at these videos, I'm going to have you describe what can be done.
Yeah. Well, this is for men. This is a long-term solution. This is called an inflatable penile prosthesis. It's something that we can put in a minimally invasive manner. And you can see by this video, the man is finding a small pump, which is in the scrotum. And there's 2 cylinders in the penis, and he squeezes the pump, and it inflates. And then you can keep it up for as long as you want. It's a very strong erection. I tell guys you can hang a towel off of it. The sensation is the same. Ejaculation is the same. And then when you're done, you just hit a little deflate button, and it goes down. That particular model, the Boston Scientific one, there's 2 major companies that make these things, and I like the the pump on the Boston Scientific, I think it's very easy for patients to find. They just came out with a new one. And it also has a special antibiotic coating you can see in the yellow there, which eventually dissolves and gets absorbed, and that helps with decrease the infection rate also when we do these procedures.
And again, that's because that's what always people are worried about, infection. What is that made of?
Yeah. Well, silicone, various plastics and so forth. I mean, the technology is incredible. Actually, I went to the company one time in the early 2000s to watch them being made, and it's this beautiful, sterile environment. It is fascinating, yes.
So obviously, if somebody had a kind of an allergic reaction or something to plastic, they wouldn't be able to go this route.
Well, yeah, that'd be extremely rare.
Okay.
But I've never seen a reaction. But they can, these things can get infected. It's extremely low, very low. And all the techniques we do everything we can to avoid infection. But unfortunately, that is one of the complications. But we're talking in the very low single digits.
So if someone has had prostate cancer, and I know there are a lot of men that when they hear that, they're trying to figure out, well, what do we have to go through if we are diagnosed with prostate cancer? And everything I've always heard from men over the years is, all I think about is that my sex life is over.
Right. It's not over. But yeah, the important thing is screening and diagnosis. So screening, we talked about the blood test. A lot of guys are fearful of the finger exam.
Yep.
So when you come to a urologist, we'll do that, I think, as a baseline, but it's not necessary every year. That's a little bit fallen out of favor. So that aspect of it, guys just, need to get over that and talk about that with their doctor, because it doesn't need to be done every single time. But the first thing. Second, a lot of these prostate cancers don't need to be treated. We diagnose men later on in life. The most common age of diagnosis is probably in the upper 60s, like close to 70. But many men are placed on what's called active surveillance, and that has changed dramatically from my training. When I was at Mayo, even if you had a low-risk cancer, we had you in the operating room, 2 to 3 months later after biopsy. Nowadays, many of those men we can watch, and there are certain blood tests, genetic tests we can do, MRI technology. So that's one thing. Not all prostate cancer needs to be treated. Secondly, for the men that do have something done, robotic prostatectomy, removing the prostate in a minimally invasive manner, that's one treatment option. And that's where, unfortunately, you see side effects of leakage or ED. But there's radiation, there's freezing the prostate, there's hormones, there's focal therapies, and, cyberknife, proton beam, all these things, not so much standard, but there are treatment options.
Again, that's the big thing that I hope you're listening to, because if someone is diagnosed with prostate cancer, right away they're thinking, all right, I have to have surgery.
Right.
And what's going to happen at that point? Very interesting that maybe it's just a surveillance, like I said. I'm going to put you on surveillance right now. Again, comments coming in. Richard said it's been many years since I hung a towel on it. Okay, well, see, we want you to be able to get that. So if they are having that particular procedure done, again, and that's through Boston Scientific that you work with them, I'm just going to say that. How long is their erection? How long can their erection last?
Well, they can keep it up as long as they want.
Interesting.
Yeah. So when you have the implant, though, then that's the only way you can get erections ever again. It's not natural. And if the implant for some reason stops working, then you have to put another one in. And 90% of them are still working at 10 years. And again,
I was just going to ask you for how long.
This procedure has over a 90% patient and partner satisfaction. But again, a lot of guys ask me, can you make it bigger? Can you make it longer? Can you do all these things? And unfortunately,
bigger isn't always better, guys.
Unfortunately, we can't do that because we take very precise measurements at the time of surgery. And we always put the one in that we think will maximize length and girth. And that's important. We have multiple different models to choose from. There are other conditions such as Peyronie's, which is a curvature that we have to address sometimes. But again, this is sort of the final
right. I was just going to get into that.
long-term solution. Before we get to this point,
yes,
there are pills, obviously, and they're advertised everywhere, so everyone knows the names, and many of them are generic now, so they're much more affordable. But there's also injection therapy that we can use. And then when those fail, then it's time for implant.
Okay, he literally just took the words out of my mouth. That's where I wanted to go, is that particular procedure, we're not going to jump to that right away. But from the pill standpoint, and again, no need to give all of them their recognition. You know what they are. There are a lot of side effects to those.
Yes.
And that's where a lot of guys are like, well, I've tried that, but holy cow, I've got raging headaches or all those things. So what are the injections, and are there side effects to the injections?
Yeah, well, there are injections. There's multiple different strengths. Usually it's a mixture of 3 different medications, so it's called trimix. And we always do a test dose in the office. So to evaluate somebody that's failed medical therapy, we give them a test dose at a certain concentration, see what the effect is, and then we do what's called a penile Doppler ultrasound. We ultrasound the arteries, the veins, the penis to evaluate, to number one, see what dose they would require of trimix, and two, to evaluate them for potential surgery for insertion of one of these implants.
And you said it would last up to 10 years?
So yeah,
or longer?
We've had patients I've seen that have them in for 20 plus years.
Really?
The technology is remarkable. Placed properly, then these have a very long life.
And then we're going to get into another procedure that we mentioned, and we'll show the video of this. We're going to take a quick break again. When we come back, it's the urinary incontinence issue, which I really wanted to stress today because there are a lot of guys who I think they think that's tied to women. Oh, women have to deal with this. No, it's a possibility, as you mentioned, from a prostate standpoint. We're going to show that video. That's tied in with Boston Scientific also, right?
Yes.
So we'll take a quick break. Any other questions that you have, please drop them in. If you can't continue to watch live, come back to the show. It's a very powerful show that I just want to spread and spread and spread all throughout social media to get you guys talking. We'll be back.
Monica's show. It's very informational, but more importantly, inspirational.
People such as myself and others can come out and talk about real issues that are taking place in our communities.
These are amazing, really, really important topics that don't get discussed enough.
It really just promotes people who are making change and doing good in their lives.
Well, if you tuned in late, you didn't see the forecast where I said it's truly still pool time this week and even into next week. So a lot of you, like us, leave your pool open through maybe late September or early October. I would do so. Don't close it just yet because we're talking 90s, even low 90s for the next few days. Great pool time. That pool, by the way, is right there on the West Outer Road in Arnold. Those are our friends, Just Pools. They are pool and spa specialists. So we went in. In fact, one of my team members, Todd, went in yesterday and was looking at how much inventory they have left in that big 50% off sale. They still have a lot, but it's until they last. We're talking about all those floats, the toys, the noodles, 50% off. Grab them for, yes, the end of this year. There's the inside, by the way, that you're looking at. Chemicals, maybe you want to stock up on 10% off those closing kits because, yes, we will have to close them. It's always a very sad time of year for me when the pools have to close, but it makes room for the spas. So Just Pools, they are pool and spa specialists. Please, again, go in and support those that support us. They are located at 3987 West Outer Road in Arnold. There's their phone number, 636-464-7110. 737, welcome back to the Real Monica Adams Show. Yes, it's all about our guys today, talking about men's health with my friend Dr. Salim Hawatmeh, again, South County Urology. So you can call him, set up an appointment. Don't wait. That's the biggest thing, is we want, if something is wrong, that it's prevention or catching things early. So we talked about prostate health, prostate cancer, and then things that could possibly happen coming out of that. So urinary incontinence, we mentioned it earlier in the show. Let's bring it back into this. There are a lot of men who don't think that that happens to them.
That's right, yes. And most commonly, as I said, it's following prostate cancer treatment. There are other conditions where men will have the incontinence, and there's two different kinds, really. The stress incontinence, where you leak with movement, coughing, sneezing, abdominal straining, but also there's a component of overactive bladder, urge incontinence, which is more common in women, but still can happen in men. But there are treatment options for both.
Okay, so we showed a video about, again, they're not just going to jump to that for erectile dysfunction, but that is a possibility of something that could be put in by your urologist for ED. There's also a procedure for incontinence. Let's go ahead and show that video if you can walk us through this.
Right, yeah, this is called the artificial urinary sphincter, the AUS. And again, life-changing procedure for many men that are soaking pads daily. But once a man wants to urinate, he finds that little pump in the scrotum. And again, I want to stress, you can't see any of this. So if you saw a man, without his clothes on, you cannot tell that he has an implant in either the penile implant or this one. And so this one allows a man then about 2 minutes, that cuff deflates that's around the urethra like that, and allows a man to empty his bladder.
It's fascinating.
And then it closes automatically afterwards.
This has been around for how long?
That has been around for decades as
Really?
well. Very high success rate. And really, as I said, it's a life-changing operation for many men.
Boston Scientific, absolutely amazing. I love, since you and I did our first show years and years and years ago, the advancements in medicine are mind-blowing. I believe when I had you on my health and fitness show, we were talking about you using the robotic arm surgery, right?
It came out recently, the early 2000s.
Yeah.
And yeah, absolutely. And we have multiple versions of that robot now. Technology's changed dramatically.
And it's just fascinating because people back then, I think, heard that and thought, that's like other world. That what, we're using robots in surgery?
Yeah.
How often is it used?
Well, it's a very common procedure, one of the most common in the United States. You can see, the surgeon sits there on the Da Vinci console, and it's like a 3D high definition, video game, basically, is what I tell my friends that I do. But yeah, it's got hand controls, foot controls. You're looking through a screen, and you have an assistant there bedside. They can change instruments for you. But it's a remarkable machinery because you can be your own assistant, you can magnify, you can see things that you couldn't really see before. And like I said, the techniques have changed and patients are doing very well as an outcome.
We're just going to continue to see that aspect of medicine creep in more and more. I thought I would bring this up. I did a show many, many months ago about people having an avergence to AI, right? Artificial intelligence. What is your thoughts about AI in medicine?
Yeah, well, obviously there's a role for it. Right now, many doctors use it in charting.
Yes.
You can walk into a patient's room, it can listen to your conversation, and you can do a whole note. So I haven't gone down that route yet. I've looked at a few, tried them out, but yeah, in terms of surgery, I think that's going to be a major issue. I think with AI technology, and there's some work with the newest version of the Da Vinci robot to incorporate that into surgery.
So let's stress this. A lot of guys might be listening and thinking, oh, okay, the discussions they're having have to do with older men. What is the youngest that you have treated with prostate cancer?
Yeah, I actually just scheduled someone the other day who's in his upper 30s for this.
Really?
Yeah, 30, 36, 37. That'd be on the very young side. I've treated men in their 40s, people with strong family history, the 50s, 60s. I mean, really all age ranges.
But wow, 30s.
And yeah, that's on the extreme.
But it's, again, to get you talking. And the reason I said that is I want you to be thinking about this. So symptoms, most men have no symptoms of prostate cancer. However, symptoms could include this. So frequent urination or a weak stream, right? So are we talking about them waking up several times throughout the night?
Yeah, and that's another reason to see a urologist. But most of these things are due to enlarged prostate, not necessarily prostate cancer. So I get a lot of patients. They say, well, I have one of these and I'm worried I have prostate cancer, but they don't. It's just a symptom of an enlarged prostate. And we have multiple treatment options for that, including medications, minimally invasive procedures, and more invasive procedures when necessary.
And again, if they see blood in the urine, which I'm surprised no one has asked yet, but I was going to bring that up. Blood in the urine, should they be alarmed and go into you immediately?
Yes, that is something that we need to see right away for blood in the urine. That requires a workup with some sort of imaging like a CT scan and also looking inside the bladder to make sure there's no issue there.
And I'm going to bring this up because I think it's important, and I always love to be real with you. That gentleman right there, who I lost when I was 24 years old, evidently had bladder issues very early on in his life, but never wanted to talk about it. Then, evidently, had blood in his urine. My dad ended up dying from bladder cancer that metastasized and took him in 10 months after being diagnosed.
Right.
But this is why, I got chill. This is why I want to stress this, because had he talked about it earlier, got into the doctor earlier, who knows?
Right.
And this is what is so important.
Yeah, bladder cancer is one of those things. It can be very aggressive. Unfortunately, we see many complications because of that. But yes, blood in the urine, even one time, we call it painless gross hematuria. So no pain, just an episode. You might see a blood clot, and that could be a sign, obviously, of something that needs to be treated and needs to be addressed immediately.
Right. So you mentioned enlarged prostates. So if you're catching that in their test, aren't you? In the test that we're stressing need to be done?
Yeah, well, just because a man has an enlarged prostate doesn't mean it needs to be treated. We go by symptoms, and we need to make a diagnosis. So we'll look in the bladder with a scope sometimes called a cystoscopy. Other times we'll do an ultrasound of the prostate to see how big it is, look at the anatomy. We have other urinary tests that we can do in the office to determine the best course of treatment.
And so here's the thing that I want to bring up, because this has been a discussion over the last couple of years with people around me, that they're comparing their numbers and they're like, oh, well, mine's 4. Well, mine's 6. Wait a minute. Mine's 8, 10. Should I be scared over here? What is the range that it should be?
Well,
does that vary?
Talking about PSA, obviously, and that's an age-specific thing. There's a range.
Okay.
So for an 80-year-old man, you'd accept a PSA of 10, for example.
Okay.
But in a younger man, 2.5 would be considered elevated.
And
in the old days,
younger
it used to be
in what age range?
in the 40s or 50s.
Okay.
And then for other men, again, you're allowed to go to a higher PSA. But most commonly, a high PSA is due to an enlarged prostate. And you could have a low-grade infection as well, called prostatitis. You could have ridden a bike in the last day or two. That would elevate the PSA.
Okay.
Strenuous exercise. But yes, that's important to figure out. In the past, we overdiagnosed people with prostate cancer, and nowadays we're actually trying to do biopsies and diagnose only if necessary. We want to try and identify the patients that are at risk of higher grade prostate cancer, moderate risk prostate cancer, and we try not to diagnose or not to do unnecessary things in men that don't need to be diagnosed or treated.
And that biopsy is not necessarily a walk in the park, by the way.
Yeah, there's a couple ways to do it. So nowadays, MRI technology's changed. So we'll do an MRI, and if we see an abnormality, we do what's called an MRI fusion biopsy. And that's usually done with anesthetic. So guys are comfortable. It's very quick. It takes like 10, 15 minutes. But for guys that have a normal MRI, or for other reasons, we do it in the office, and that's under local anesthetic. And we have all kinds of stories. Some guys sail through with no problem. Others, not so much. But we do our best to, do the proper local anesthetic blocks. Nowadays, we can use nitrous oxide for sedation in the office, so that's changed.
I love the advancements in medicine just to make you more comfortable and to get this prevention again very early on. I will say this as a woman, and having experienced it firsthand, hold their hands, because when they do the biopsy, it's been described to me by a couple of men that have had it done. They're like, Monica, it's like aeration of a grass. And I was holding his hand, and I thought my hand was going to break. And it was like, how many more? So I think there was like 12.
Yeah, we'll do 12, depending on the size and the anatomy of the prostate. 12 is standard, but many times we'll do just a few extra. Yeah. Hit certain areas that we want. Yeah.
But some of you evidently, you sail through it. Others, you might break somebody's hand. Do we have a comment coming in? Yes? Okay, let's see. If I see blood in my urine, I am definitely getting alarmed. That's what Richard said.
Yes.
Well, I actually think it's a good thing, though. You should not dismiss that.
No.
Get in immediately.
Correct. Very important.
And make the call. Let me put the phone number, by the way, on the screen for South County Urological. 314-843-8000. If you have a doctor that's dismissed things, because that's the other thing. I always tell you to be your own advocate and find a doctor that really works for you. Dr. Salim and his father, Abraham, Abe. And then what other physicians you have there?
Dr. Frederick Walters is
okay. That was the other one that was in the picture?
In our practice.
So, again, phenomenal. And your father's been in the industry how long?
Oh, a long time. He wouldn't like me saying, but how long? But yes.
He's like, no, I'm young.
A very long time. Still practices.
And you might recognize the name as well. So he used to own, was it the Steamers?
Yeah, the Ambush, St. Louis Ambush. He got involved in the Steamers toward the end, and then with the Storm as well, and then the Ambush.
So, again, you may see Abe, you may see Salim, phenomenal physicians, or you may see Frederick Walters. But if you do not have a urologist right now and you are saying, hey, I probably really need to get into one, I would love for you to do that. That's very, very important. Okay, we're going to take another quick break. Any questions that you have about you or someone that you're involved with that they've gone through, please let us know. I'm going to go back to erectile dysfunction and anything else that Dr. Salim wants to talk about or you want us to talk about before we wrap up here. All of that coming up next. This is my wonderful role model, one of my best friends.
She's, oh my gosh, you got a long life. You could probably live to be 130 or something. And I said, oh God, I hope not.
It's getting hot in here. Don't take off all your clothes.
I'm not going to take off my clothes. On the radio tape, going to be
Kansas City, Kansas City, here I come. We're gonna speak
to spank anybody. We're going to speak about knowing your value. And then I'm going to ask.
I'm going to spank them.
If you don't know your value and you don't grab hold of how important you are, I'm going to spank you.
Folks, you never know what you're going to get with her. Love that, by the way. Mom and Mon Senior Moments. It's a segment that you've asked for a lot, so we'll bring her back on. So we're talking here during the break about men not wanting to get into their doctors. Why?
Yeah.
Why do guys not want to get in?
It's just the tendency of guys, I know. It's amazing. We see guys that have had years of problems and finally their wife brings them in, something. But again, we talked about some of the symptoms earlier, including blood in the urine and some of the urinary issues. I want to stress that most of these things are benign conditions. So it doesn't mean that you have cancer,
right,
necessarily. So, but the important thing is a workup.
And I think that's why it's important to say that, because if you have any of these symptoms, don't you want peace of mind?
Right.
But I think the reason, from what I've always heard, men are like, yeah, but I don't want to be told bad news.
Right.
I'm scared.
Right.
I'm glad that they've at least used that word, I'm scared. But we're talking about this, the importance is catching something early. And again, we're not saying that it's cancer. There's something, whether it's an infection or there's something else going on that can be fixed.
That's correct, yes.
That's the greatest thing. I want to give you that website again, edcure.org. So there's a lot of information that you can find there, thanks to our friends from Boston Scientific. We talked earlier about erectile dysfunction. So symptoms of things that could possibly be happening. Again, let's go to that again, because there's people that sign in late. What are the symptoms? And as it starts to happen, we mentioned pills, we mentioned injections, we showed you a procedure that could possibly take place. But is there anything in the early signs of it that they should be getting to earlier?
Yeah, well, just not being satisfied with your erectile function. So whether you're not being able to get an erection at all, but we're not lasting as long, or premature ejaculation, all of these things should be evaluated and treated by a urologist. And
you're seeing the common symptoms. He just mentioned the inability to achieve an erection, to maintain one for firm enough for sexual intercourse, the inability to sustain an erection long enough to complete sexual intercourse. And I know what that does. I mean, obviously, this has to happen, and let me just stress this, whoever your partner is. You would hope that you have such an incredible connection with them that they understand, they walk you through it, but they say, but you don't have to live this way. Why don't you get in and discuss this with your doctor?
That's correct.
Let's go back and we can show that video again of the procedure that can be done for erectile dysfunction. How long is this procedure? How long does it take?
Yeah, usually it takes about an hour.
Okay.
And can be done in a minimally invasive manner. Many men, we can do this as an outpatient procedure, just a very small incision, and they're able to use this, 4 to 6 weeks later. Some guys are ahead of schedule; they can use it at 2 weeks, but it's, like I said, over 90% patient and partner satisfaction. This will get you a functioning erection every single time you want to have one.
And he mentioned that some 10 years, he's seen some people that it's lasted for 20 years. So an hour, that's what I wanted to know, how long it would take. But then after the procedure, they're waiting about a month and a half?
That's correct. Yeah, there's some swelling and bruising that needs to settle down. And, we see guys back throughout that period to make sure that everything's okay and everything's going well. But yes, usually about 4 to 6 weeks later, they start to use it.
And so if you look at the order of what you would talk with someone about if they're dealing with it, they come into you right now, or they're making a call to you later. Okay, I am dealing with this.
Right.
I didn't ask any questions because I didn't want to put my name out there, but yes, I'm dealing with this. You would start in steps prior to that.
Right.
Would you ask them, have they already tried pills?
Correct. Yeah. Usually if they come to see a urologist, they've already tried pills from their primary doctor or get
online.
them from online.
Can we stress though that's you don't want them doing that?
Yeah, I think it's always better to see a urologist.
Yeah.
And many of these things are just sold for profit, basically. Mm-hmm. And so, we just want to make sure that patients get the best possible treatment. And again, I said there's a lot of snake oil out there.
Absolutely.
In social media promising all sorts of things and length and girth and all these, but yeah, all of it needs to be evaluated properly by a urologist.
You'll laugh at this, or maybe you won't, because you'll probably be like, oh yeah, I've seen it. We are getting ready to go to Cabo next week, and everywhere along the marina are all these guys going, Viagra? And I'm like, you're buying Viagra from someone walking around on a marina?
Yeah.
That just shocks me.
Right.
But it happens.
It happens. The guys, back in the day, they used to get them from all these online sources. I read some study once that for generic Viagra, and the study showed that some of it was actually drywall. I mean, there were some crazy things that were happening out there.
You always need to get that from somebody reputable, again, like your physician. Let's go back to that slide, because we've talked about pills, we've talked about injections, as well as suppositories.
Right. Yes, there is a suppository. It's called Muse, and you insert it in the tip of the penis. It causes a little burning. It's an expensive treatment.
Okay.
I'd say it's not as common as the Trimix, the injections.
Okay. What about a vacuum erection device?
Yeah, we sometimes will use that with post-prostatectomy patients to maintain the length and make sure there's no fibrosis. But I've never really found anyone to say that that's some wonderful treatment option. I have a few out there, but we don't use that as commonly.
What about the implants? Is that more on the lines of what we just showed?
The implant, yes.
Okay.
When the pills don't work, when injections don't work, statistically, 50% of guys stop injecting at a year's time because they're just sick of sticking a needle in their penis.
Mm-hmm.
And it causes pain and bruising. It's not romantic, it's not spontaneous.
It can't be pleasant at all.
Yeah, you gotta travel with it, and that whole I've had patients try to get all sorts of contraptions to keep it, because it has to be refrigerated. So that's an issue.
Well, yeah.
And
you're like, hang on a second, honey.
That's correct. There is some technology, wave therapy. Again, this is highly marketed out there by many clinics, and not all wave technology is the same. So as urologists, we have the real machinery that can do this, and there is data out there. It's not a FDA approved treatment. However, it does seem to work in the right patient. But again, I have to stress, it has to be the right patient.
Right.
It cannot be someone that has a major issue with ED, because it will not work at all, and people are just spending all this money for no reason whatsoever.
And you have heard me before, in all the years I've been around physicians, again, as he mentioned, he and I did an interview. How many years ago was that?
It's been a while. I don't want to date myself.
Oh, look, you're just like your dad.
I just got some congratulations from the hospital for my 18th year there. So I guess it's been about that.
Yeah, I was going to say a couple decades. We talked about so many levels of this, and here we are all these years later, but we're talking about the advancements that have taken place. But I also am always big, that I'm a huge fan of the marriage between traditional and functional medicine. What are as a very respected physician in our area, do you, with your patients, say, these are the things that I want to do, but this is what I'm going to tell you that may fall more in the lines of functional or integrative medicine? Sometimes it has to do with diet and nutrition.
Yeah. I wish people had better diet, nutrition, more active. Obviously, that so many health benefits, not just with erections, but cardiac health and so forth, and maintaining your weight and self-esteem. But yeah, I think there's a lot of treatments, for example, for low testosterone out there, and there's gels, creams, nasal sprays, pellets, injections. And, I always tell patients, I say, I look at the numbers, I look at their age, do a full evaluation. I'll say, well, this is what I recommend, and this is what I would do, and you'd feel the best using this. And my interest is just the well-being of the patient.
Absolutely.
And the good thing, we talked about all these clinics and so forth earlier. As a urologist, I'm dealing with kidney stones, cancer, major surgeries. We talked about some of these treatment options, ED and incontinence. Right. And for all my patients, I just want the best possible thing for them. And I have no financial interest, for example, in prescribing this or that or doing that. And so I think that's a benefit, is seeing a reputable board-certified urologist.
And again, no patient has cookie cutter of we're going to use all of this across the board with each person. That's why they have to evaluate and see what's going on with you, and then say this is what's right for you. I'd love to bring you back and talk testosterone more in depth, because again, as we mentioned, there's a lot of clinics out there, and then people are confused of, do I get an injection? Oh, I've heard somebody getting a pellet inserted. Wait, what? How long does that last? And oh, well, once it's in, it can't be adjusted. We're going to save that.
Right, okay.
That and so many other issues for men's health that we can discuss. Again, let's bring up on the screen how they can get in touch with Dr. Salim Hawatmeh. If you do not have a urologist, or you're not happy with the one that you're currently going to, I don't put my name behind many people. He's been a longtime friend of mine, and I just have great respect for him. And I will say they are my husband's doctor. And he was... So the way you walked him through what he felt was scary, I cannot thank you enough because it wasn't the easiest time period. But that's why, ladies, you need to go along with them. 12345 West Bend Drive, Suite 200, South County Urological. Again, right there at 270 and Tesson Ferry. There's the phone number, 314-388-6530. And again, Monday through Friday, 8 a.m. to 4:30. If anything for this show today, it's to get you talking. And if you have to talk within your own family first, great. You'd be surprised, though, because since my husband went through the things that he did, he started talking with his cousins. They started talking about it, and I was like, look, this is the most beautiful thing of saying these should not be taboo topics.
Right.
And you're stressing that as well.
Absolutely.
Got to get these guys talking. Specializations, by the way, including all of that you're seeing on the screen and so much more. Again, you can trust them. We're going to take a break. Thank you, Salim, by the way. We're going to take a break. 100 Days to Freedom from Shame. It screams today, right? Oh, I'm shameful if this is happening or that's happening. We'll do that, and we've got some big shows coming up, some live shows that I would love for you to be at coming up in October. We'll tell you about the full rundown of those when we return.
She's a special woman and done so much for St. Louis.
Watching her work is one of the most incredible things you can see.
She just sees value in everyone.
Sometimes people just need you to sit with them and hear them. I feel heard.
The time flew by, and it was like sitting and talking to a friend.
Not only creating a better place here in St. Louis, but to inspire others. It's always great to have examples like you.
You have such a light and such a presence, and I could feel it this morning.
We knew right away when you started this, we wanted to be on your show. Thanks for having us.
I look forward to seeing how you rock and roll and shake it up.
Yep, let's shake it up. And that's what we were trying to do today, to get you guys talking. One more time: erectile dysfunction, urinary incontinence, PSA test, prostate cancer, all of that. And we want to thank Boston Scientific being a big part of today's show. Look at their website, edcure.org, to find out more information about what we've discussed. All of us ladies here are saying, yep, probably didn't think the guys would be asking a bunch of questions, but I can guarantee they're watching. So share it. Maybe take a specific part of today's show and say, listen, right here at this point. Tell the guys in your life, if you have heard them complaining about any of these symptoms that we've talked about, please do so. Okay, 100 Days to Freedom from Shame. I just feel this one from Stephen Arterburn really fits, because there's so many things you might be shameful for. A lot of it, again, dealing with ED. You're shameful that you're not able to sustain an erection, or that the relationship that you have has suffered. Don't let it, okay? There are things out there for you. Red-handed. The Pharisees brought a woman who had been caught in the act of adultery. This is John 8, verse 3. Caught in the act. Think about just that sentence. We call it being caught red-handed. It's a term that originated hundreds of years ago. It refers to a murderer being caught with blood on his hands. Of course, a novelist can easily take a suspect with blood on his hands, flip the details upside down, and make him innocent. But in real life, being caught red-handed generally offers no way out. The woman in our verse for today was caught red-handed committing a capital offense. In that culture, people who committed adultery, remember this, they could be stoned. The Pharisees, who hated Jesus, cared nothing about her life or her soul. They merely wanted to leverage her sin to try to make Jesus look bad. But let's forget about the Pharisees and Jesus for a moment, and let's zero in on the woman. It pains us to think about her being caught red-handed. How awful, how humiliating. The love or desire she must have felt when the act began quickly morphed into terror when the door was flung open. Still, I believe it was the best thing that could have happened. If she had only been rumored to have committed adultery, she likely would have been tempted to lie and make excuses and try to save herself. The fact that she was caught red-handed means she had no option except to stand broken before Jesus. More people need to stand broken before Jesus. If you want to overcome the shame you're feeling, you need to stand broken before Jesus. If you were caught red-handed, don't bemoan the fact. Thank God for it. Yes, it was humiliating, but it might be the thing that kept you from compounding your sin by trying to deny it. Contrary to what we would expect, brokenness is the pathway to blessing. That's what Nancy DeMoss said. And here's your prayer for today. Lord Jesus, may I never forget the grace you showed to the woman caught red-handed. May it always remind me to bring my sin and my brokenness to you instead of trying to defend myself. Broken before Jesus. I like that. Okay, a bunch of really amazing shows coming up. October 4th, October 10th, October 19th, a gala. I want you to get to these. Let's start with October 4th. It is our big 400th show that we cannot wait to celebrate with you. That's right, 400 shows that we have been doing since June 12th here in our studios, but we're counting back to when we started at home. 5:30 to 7 p.m. We're going to celebrate the 400 episodes, but more importantly, we're going to raise money for our first responders. Responder rescues, who will we be donating to? So tickets are on sale right now. I think there's about 25 of you that have purchased your tickets already, which is awesome, but you got to keep sharing this with your family and friends. $40, and you're going to get an incredible steak dinner, steak, potatoes, salad, a couple of drink tickets. We're going to have music. We'll have giveaways. I want you to stroll around and get your food. Go outside, beautiful outside, adjacent to the Katy Trail. Go over into their market. Just enjoy a lot of really wonderful laughter and just time with your family and friends. Pick up a little something for the days after as well. I keep going there and getting these sunflower shoots that are incredible. That's right, there's things for the dogs. They've got some really incredible treats there. My dogs are loving the duck ones. I'm just going to tell you that. They devour them. Cool merchandise, t-shirts, hats, things like that. Again, it's called The Watering Hole, and it's affiliated with Circle 6, the farm. That's just a few miles down the road. The Watering Hole and the market. Bourbon, beer, beef, besties, badges, all the bees. 2998 South Highway 94 in Defiance. We would love to see you there, October 4th. October 10th, I'd love for you to come to a noon show, which will be held at Yenology, where our beautiful candle is. But so many things to bring you calmness. Yenology, it's not a real word. She came up with that. That's Sarah. She's the owner. Love her. She said it helps those who long for comfort and peace from mindful goods and medicinal accessories that complement the journey. That's a view into their space, located again on Lindbergh in the Frontenac area. I can't wait to be there, and I hope you grab a bunch of your girlfriends, maybe couples come to this. Feel the Wave. That's the name of the candle that we have here on set. That is their theme. Feel the wave. Feel the calmness. They've got, for those of you that love essential oils, you want to sage the negativity and the energy that's in a house or a workspace. So many levels of things to bring you to that level of calmness. Compassionate, collaborative. They collaborate with a lot of small businesses. Comfortable, dedicated, and they welcome everyone. Again, a noontime show that we will do on October 10th. We've got some other big things, by the way, that we have planned with Sarah and Yenology. So start talking. I'm doing this kind of like save the date thing. I'd love to see you there. Come and join us that day. Be on the set with us to enjoy that calmness. And then October 19th is our big gala that we are emceeing and auctioneering with Yuppie Puppies Forever Rescue. And I just saw yesterday, Guinevere was adopted. Guinevere is a dog that so many people turn their nose up to. No. Guinevere had cancer, had so many other things that people would say, not the right dog for me. She scares me. Well, one guy took a chance on her, and she was adopted yesterday. And so was Karen, by the way, that little sassy corgi. Karen was adopted as well. Finally found the right person for Karen. So the gala is a whole new world with you. It's, again, October 19th at Whitmore Country Club. We would love for you to be there. Arrive at 5:30 for cocktail hour. Aura readings. The event will wrap up at 10 o'clock. There's going to be live auction items, silent auction items. I know Jessica is super busy putting this all together. And when we do Positive Talk Time on Thursday, we're going to do the Parade of Dogs this time. We've been waiting for this one to happen. You're going to see rescue after rescue after rescue this coming Thursday. And hopefully you'll find a dog that's right for your home. Also excited for Steve Ewing. You remember him from The Urge? He is going to be performing the music that night. If you haven't purchased your tickets yet, I think they've got about 160 sold, but we want to sell this out. $90,000 is what it cost them just this last year to take care of all those wonderful animals. And she just keeps saying yes as much as they can to take in more. Again, Yuppie Puppies Forever Rescue. Look for our show this coming Thursday, 7 a.m. Positive Talk Time. So yeah, a lot happening. And by the way, would you like for us to bring the show to your event or festival? A lot of mobile Monicas that we started back in January that we will continue to do. All you have to do is reach out to me and my team, info@TheRealMonicaAdams.com. Let's make it happen for you. Thank you so much for watching live. If you have friends or family that couldn't watch live today, we know that. Now, I want them to watch a little bit later. They scroll. Hopefully, they'll catch something that really makes them dig into today's show. Share, follow, like our live stream Monday through Friday, 7 a.m. We are on Facebook and YouTube, and then all these reels and stories on Instagram. We have them on Rumble. We have it on TikTok, as well as X. Just keep saturating media, social media, with the importance of talking about men's health. It's all about you guys today. Thank you so much for tuning in. And remember, be kind to everybody. It's the greatest thing that you can do to start changing this world that many of you are you have your spirit dampened. You think it's just a hateful world. It can be better. It can be more positive. You just have to believe. God bless you all.